Good morning, everybody. Dear colleagues, it's a great pleasure to be here in such distinguished summit. My name is Stevanovic, and I have been working in public health sector in Croatia for more than 40 years. Unbelievable. There you have content of my presentation, 3-part. First is Croatia, citizens and profession versus legislation. In 2021, one independent market research agency conducted a market research regarding smoking habits and alternative products. In the research, they included only current smokers, where they asked them about their current habits, knowledge, and attitudes toward alternative nicotine products. Results tell that half of cigarette smokers are concerned about their health, and 72% of them believe that they have the right to know all the facts about alternative nicotine products. 58% of smokers are interested or highly interested to switch to alternative nicotine products, and 63% of them would like to do it for their health. The only 9% of smokers thinks that they have all important information about alternative nicotine products, but over 50% of them individually seeks additional information. That is why 50% of them wants less restrictive regulatory framework for such alternative products, and that they should not be equalized with cigarettes. A few words about two Mayor Society and General Practitioners research, and starting an initiative with following conclusions. 90% of GPs believe that the existing official smoking cessation tools, for example, schools of non-smoking replacement, nicotine therapy, and the like, are ineffective or low performance. Our duty as doctors is to participate in informing our patient smokers about the scientifically based facts about the benefits of these products for them. At the heart of these recommendations is the legalization of the concept of harm reduction, which says that smokers who smoke cigarettes and cannot stop this habit should be motivated to switch to alternative products that have a scientific basis of reduced harm compared to cigarettes. Local legislation is starting from 1970 with and is national legislation effective from 1917. Some regulatory treatment of cigarettes and smokers' products is regulated: indoor usage ban, display ban, etc. And I think it is a problem because government applies only the WH policy. Few words about non-government organizations, about society from whose I come. Smoking in Croatia. Facts about smoking in Croatia is, in Croatia, 1 of 3 people smokes. 1 of 2 smokers will die because of smoking. On average, smokers die 10 years earlier than no smokers. They have a limited interest in social studies concerning smoking in general and including alternative products. From year 1978, the only 293 smoking-related scientific papers, presentation on scientific conference, etc. in Croatia is done. Local legislation following European Tobacco Products Directive and tobacco harm reduction is not accepted as a concept, with low awareness of the concept among scientific healthcare community and public. Few words about Croatian Society for the Harm Reduction in Public Health. HARF is short name. HARF is an association founded as a non-governmental, non-profit association of health professionals, experts from other fields, and citizens gathered around the idea that in society it is necessary to develop a system of policies, programs, practices, and products that are related to certain unhealthy lifestyle choices. HARF is focused on promoting scientifically proven products and methods, but also on appropriate legislative support for harm reduction principle in different health aspects. We want to promote harm reduction concept in society as a novel approach for healthier nation that works together with prevention that starts from pediatric age, from the childbirth. Raising awareness and positive regulation in tobacco harm reduction concept is one of the goals of HARF. Two small steps maybe of HARF I will now present to you. On February 2023, Croatian Parliament unanimously adopted National Strategy for Action in the field of addiction for the period until 2030. Maybe one of most important sentences: it is necessary to facilitate the application of damage reduction concepts that have been scientifically proven and are changing with individually beneficial result in the countries of the European Union. Second step, because the initiative of HARF, Parliamentary Committee on Health and Social Policy held a thematic session on the application of harm reduction in addiction and risky behaviors. Maybe one conclusion, most important conclusion is, with the aim of improving public health in Croatia, the application of harm reduction principles in all addictions and risky behaviors shall be supported institutionally and legislatively, as well as included in the position of the Republic of Croatia represented at European and international forums. One of the future HARF steps I'll present now, the HARF, together with Croatian Society for Pharmacoeconomics and Health Economics, is developing a special mathematical model to estimate the impact of the healthcare budget for switching smokers to heated tobacco, assuming 10%, 25%, and 50% of smokers switch. This calculation should be another important support for achieving an objective and necessary attitude of the state, politics, law, and professionals toward harm reduction that fears misinformation and controversies that spread in the media, social networks, association of professionals, and among patients and citizens. And some tobacco health reduction conclusions. Education about healthy living habits from childhood. The quitting smoking is the best choice for any smoker, but applying the concept of harm reduction in all segments in healthcare is necessary. Research support implementation and adoption of legislation geared towards the concept of harm reduction, and it's very, very important to have openness of the professional community and the public to the concept of harm reduction. Thank you very much for your attention.